Hello and good morning, good afternoon, good evening, everyone. Welcome to the 119th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community. And to all those who have just discovered us today, welcome po. At sana po marami po kayo matutunan for today's episode. So did you know that COVID-19 has had many unseen impacts on the health of our children? And a very special group, which are the children with cancer who are immunocompromised. They have faced severe difficulties in getting access to treatment and the support that they need. According to the World Health Organization, the Philippines, meron pong 4,700 to greater than 5,000 new cases of childhood cancer every year. 40% of these are leukemias, which is a condition that is treatable and compatible with life, provided that there is early diagnosis and chemotherapy is provided consistently at regular intervals. Pero bagaman may mga ganito po, each year 1,700 children die from leukemia in the Philippines. So for today's episode of Stop COVID Deaths, and incidentally, today is the last day for us to celebrate the International Childhood Cancer Month. We will be taking a closer look at what happened to all the children with cancer during the pandemic, what has happened to groups that provide support for various needs of these children and their families, and the caregivers and parents of children with cancer facing many challenges in transporting their children to hospitals for treatment, caring for other children, and obviously simply making ends meet. So hopefully that's something that we could all tackle in today's webinar. Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday, and always looking forward to this program together with my co-host, a beloved mentor, our adjunct research faculty at the National Telehealth Center, international renowned public health communications expert, Dr. Susie Pinedo Mercado. Dr. Susie?
Hi, good afternoon, Raymond. Magandang hapon po sa inyong lahat. We'd like to greet everyone who's watching us on Zoom and who are watching us on YouTube and Facebook on live stream. At binabati din natin yung mga bumabalik sa ating programa on the playback, also through YouTube and Facebook. No? So, well, of course, our prayers and our thoughts are with all of those who've been affected by Super Typhoon Karding, internationally known as Typhoon Noru, that made landfall in the Philippines. And I know that work and school in several regions have been suspended during that day. And this also necessitated the postponement of the TVUP Signal TV Launch 101.
Okay.
Yun, postponed pala siya. So we were supposed to be on television, but because of the storm, there's been a postponement. So October 11, matutuloy na po yan. We will be able to see Stop COVID Deaths on your television screen. And we're really very excited about that, of sharing all the things that we're learning with a larger audience. And also, you know, big thanks to our director, Dr. Gigi Alfonso, and all the people behind TVUP who have made this possible to bring us to another level, Raymond, another level up na. Okay, so all right, so you know, you've noticed that when we put Stop COVID Deaths, it doesn't mean COVID lang, di ba? So COVID meaning current COVID-19 problems, and by the way, Raymond and I were just talking about this, dumadami na naman yung mga kaso ng COVID, no? But according to Stella, the hospitalization rate is not that, what should I say, that serious right now. Hopefully it stays that way. So we will continue to talk about COVID. No, this is not yet the end. Tuloy-tuloy pa rin po nito. And every time we discuss what we're going to take up, we always find a new angle. And we are so thankful that there's so many of you who continue to stay with us on the program, because there's always something new to learn, no? And as always, we bring you the best speakers. We've got great speakers for today. So mabuti nandito kayo para ma-appreciate nyo rin, ano, yung mga ginagawa ng ibang mga doctors and organizations to help patients who are not only suffering from COVID or have a threat of COVID, but have other issues like children with cancer. Now, the O is for other outbreaks, V for viruses, I for infections, and D for disasters. Hence, we say, stop COVID deaths, pero hindi lang siya COVID, no? Kung ano-ano pa, daming mga health problems ng ating community. Anyway, we know that you really want to know the latest in health and medicine, and it's for this reason that we bring you the news update.
Thank you so much, Dr. Susie, for our first news update po, no? COVID-19 has been found to raise the risk of long-term brain injury according to a large US study. This one is a finding that really could affect about 6.6 million Americans, and the study was published in the journal Nature Medicine, wherein they assess brain health across 44 different disorders using medical records of US veterans pero wala pong patient identifiers. According to the study, brain and other neurological disorders, they occur 7% more for those who have been infected with COVID compared to a similar group who had never been infected. So very important to take note po, no? Especially for those who believe na wala na pong COVID. The message is COVID is here, it's here to stay, and we should take all measures to protect ourselves from getting COVID. How about you, Dr. Susie?
Yeah, teka muna Raymond, before you leave that topic, no? Talagang no, as habang tumatagal, we're learning more and more about this, no? So, I think yung long COVID is really a major concern. Anyway, the news that I have is also kind of related to this, no? Reuters reported that Pfizer would supply 6 million courses of the COVID-19 antiviral treatment to NGO Global Fund for low and middle income countries that want to reduce the disparities in COVID response and treatment. So this is Paxlovid, no? Paxlovid will now be produced by several generic drug makers, and they will be selling it for a lower price in 132 low and middle income countries. And that's good news, no? Raymond, I took Paxlovid when I was when I got COVID, no? But
yeah.
of course, and it didn't cost anything for us, but I understand in the Philippines the equivalent is very, very expensive. So
Correct.
malaking bagay po ito na meron pong 6 million doses that will be made available. And definitely it makes the disease less severe, the symptoms more bearable, and hopefully is protective, no, for longer term effects. So that's our news for today, and next week we'll be back with more updates on the news update. Okay, so we return to our topic, which is COVID-19 and cancer in children. And Raymond was talking about this already earlier, that it is cancer. What is it, Raymond? Cancer
International
Awareness.
Childhood Cancer Month.
International Childhood Cancer Month. And you know what? I've done some work in that space long ago when I was working with Kapwa Kumahal Po. We had the Children with Cancer program, and that's why I'm kind of very, what should I say, very sympathetic with the issues. And I know that there are many young people who volunteer to work with children with cancer. And I think instead of having a person on the street interviewing, when we're going to talk to some of them, right?
Thank you, Dr. Susie. Yes, what we usually do, Dr. Susie, we have a clip with regards to those who have worked in the space, and hopefully that's something that you could relate to, especially during this time na everyone really needs the help with regards to improving access and care for these patients. Please watch this.
o'clock.
As a BS Family Life and Child Development student, I decided that maybe it's time for me to venture out from the university orgs and try something new.
I've always been fond of kids. That's why my main motivation for joining and staying with Kythe is my love for kids and community development.
And that's why I joined Kythe at around January 2020, I think. It was before the pandemic. I had my orientation before the pandemic, and I was super excited to join the hospital visits. But since the pandemic happened, I wasn't able to join any of those sessions.
I also instantly felt like I belong, and Kythe really has this very welcoming and loving community of volunteers.
So I decided to volunteer for Kythe during the pandemic, and I helped Ate Carol and Ate Ivy draw elements, work on the pubs for Kythe on their social media accounts.
One of the best things about being a Kythe volunteer is seeing the positive impact of Kythe activities to the kids. So it's really nice to see kids having fun in the hospital, even though they used to see it as a very boring or even a very scary place for kids.
My 3 greatest takeaways from joining Kythe is that 1, volunteering comes in different shapes and sizes.
Recognizing the power of teamwork. So this is for the success of every project and sharing our time and talent for the kids.
2, volunteering is a way for you to express yourself creatively and also find your strengths while helping those in need.
Helping doesn't always mean money. So sometimes our quality time, the memories, the activities we shared with the kids have a longer lasting impact to them.
And lastly, 3, you can create meaningful connections even behind the screen. Having all of these opportunities being given to me is the reason why I keep going back to Kythe.
The most important takeaway is to always be genuine with your purpose and your intentions. That's why my word for Kythe is genuineness.
Kythe is an avenue for me to draw art for the benefit of others. And to my fellow artists out there, I hope you consider volunteering for Kythe as well.
Okay, thank you very much. Ang ganda, no, Raymond. Very, what should I say, very inspiring. no?
Inspiring,
I mean,
yes. Correct.
Yeah, and we wanted to feature this to share with you na sabi nga natin, Raymond, no, lahat ng talino kailangan natin dito sa pandemya. And sometimes our patients need more than just the doctors. Of course, the doctors are very important. But can you imagine these young kids with cancer? And we're going to hear more about that we've got a great expert for you who's going to talk about this. So, ayun ano, parang mga bata, nakakatuwa naman that they're, even during the pandemic, nagvo-volunteer sila, tumutulong sila dito sa mga batang may cancer. I think that's really wonderful. So parang naano naman ako, naantig yung puso ko rin. Okay, mag-ano na tayo? May announcement ka muna.
Just a little bit of announcement. But really, I just want to thank TVUP team and also our colleagues from Kythe for being able to share that short video just so we know, well, the pulse of the common folks on the street and be able to understand their reasons for volunteering in this line of work, lalo na po putting themselves in a way in
parang exposed sila,
exposed sila kasi sa COVID po So very, very thankful for all of this volunteer work. Just a little bit of housekeeping for all those who are asking. Certificates of attendance will be given to those who have watched at least 50% of the webinar duration. We have already sent out webinar certificates for number 1 to 117th. Konti na lang po for webinar 118. So if you have any questions or if you did not receive a certificate but feel you should have, please email us at stopcoviddeaths@up.edu.ph. For today's webinar, we will be having a standard panel discussion format. Our set of speakers will be presenting, followed by a Q&A session wherein we'll be entertaining questions coming from the Zoom. So please place them in the Q&A box right now if you already have. And then also scouring the Facebook and YouTube pages po natin where we are being live streamed for any potential questions that we would like to ask our excellent group of speakers. But before we delve into the webinar, Let's cue in our cute introduction for our fun quiz segment.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Trucy, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Yun, okay. Thank you
Tatawa
so
pa rin
much.
ako pag nakikita ko yung Raymond. Sige, okay.
Can we also have it in the Zoom? Kasi I see it in Slido, but okay. Thank you so
Yeah,
much.
okay.
We have, medyo marami po tayong katanungan for today. We have 4 questions for those who are outside of the Zoom but would want to join us. Please open up your browsers, go to slido.com, enter the code 5405717. That's 5405717 when you are prompted to be able to join in our webinar. For our first question, ilan po ba, how many new cases of childhood cancer are estimated each year in the Philippines? 47, 470, 4,700, or 47,000? Yun po ang ating choices. For question number 2, is it safe to give COVID-19 vaccine to a child with cancer? Siyempre po, yung iba may mga alinlangan pa rin, no? Is it A, yes, or is it B, no? Okay, so yun po ang ating mga katanungan, ha? We would like to greet those who are joining us. I saw those from St. Marina Kidney and Dialysis Center in Vigan, from May Kawayan Doctors Hospital and Medical Center Incorporated in May Kawayan, Bulacan, from Malinaw Treatment and Rehabilitation Center in Malinaw, Albay, Antique Medical Center in San Jose de Buena Vista, Antique, Eleuterio T. Decena Memorial Hospital in Hinobaan, Negros Occidental, Edwin Andrews Air Base Hospital in Zamboanga City, and House of Hope Foundation for Kids with Cancer Incorporated in Davao City. There are those who are joining us also all the way from Laguna, all the way from Far Eastern University, from Iloilo City, from University of the Philippines College of Law, from the Southern Philippines Medical Center, the Air Force City Hospital, Clark Air Base in Pampanga, UP Los Baños, La Consolacion University, Malolos, Bulacan, the SPMC Cancer Institute, Car Sigma District Hospital in the GMA, Cavite, Rizal Medical Center, those from the UP Philippine General Hospital Medical Records Division, OPD admitting, also those who are joining us from the Department of Education po, no? Alicia South Icon School, Magsaysay, Alicia Isabela in Alicia South District Schools Division of Isabela, Tuguegarao, Region 2. Those who are joining us from Taytay, Rizal, from Osamis, and from Antique. Maraming salamat po. From Quezon City, from the University of Rizal System, Taytay Campus College of Nursing. Greetings po from the Center for Kidney Diseases and Otorhinolaryngology, Head and Neck Surgery Endoscopy Unit. Those who are joining us from PRC Muntinlupa, maraming salamat po. And so Philippine Red Cross po yun, ha. Those from Cavite, those from the RPHS Annex 1 in Antipolo, and Bataan. And maraming salamat po sa inyong lahat. For question number 3, in providing support for children with cancer, PETALS stand for, PETALS po acronym yun, ha. Is it play, educate and prepare, tend to emotional needs, assist during procedures, and lend medical assistance, support parent empowerment. Or letter B, prepare, educate, and prepare, educate, tend to emotional needs, assist during procedures, lend medical assistance, and support parent empowerment. Or C, play, empower child and family, tend to emotional needs, assist with medical needs, lend support, and support parent empowerment. Okay, sige po. For question number 4, who should take care of a child with cancer? Magulang po ba, mga doktor po ba, teachers or the school, community, gobyerno, or lahat po ng nabanggit? We'd like to greet those who are joining us from the Chonin Hospital in Taipei City, Taiwan, from Bangkok, Thailand, from Kanto City in Vietnam, from University of Hail in Kingdom of Saudi Arabia, Lunichi Ali University of Blida 2, Algeria, Stockton, California, and International SOS Luanda in Angola. Thank you so much, and we hope this is a fruitful and very informative webinar for all of you. We will not be closing our fun quiz as we move on to our webinar proper. Dr. Susie?
Thank you so much, Raymond. Parang mahirap-hirap yung tanong, ano. So,
Lalo na yung number 3, petals.
Yung petals, medyo, no. But we really put together, we think a lot about these questions because somehow it helps us, diba, when we have a parang pre-test tapos post-test. And I know many of you look forward to it and enjoy it kasi natetest din yung pag-iisip, no. Parang, iba naman ginugoogle. Okay lang yun. Kasi as long as we're learning something new, that's good. Okay, so I know you really want to go to the meat of this, and I am very, very honored to introduce our next speaker. We only bring you the best, and this person is an expert in her field in pediatric oncology, and she's internationally recognized for her advocacy work. In fact, I think I first met her in an international setting, I think in the US. And she's just been working in this space for the longest time and is very well known for her expertise. But also, she's such a warm and caring person na swerte talaga yung mga pasyente niya. No? So we'd like to introduce the head of the Children's Cancer Unit at Southern Philippines Medical Center in Davao City. Please give a warm virtual welcome to Dr. May DOLENDO. May, welcome. Nasaan ka na, May? Teka, pakita muna natin si May. Napunta na yung slide niya.
Dr. May?
May,
Ayan.
where are you?
Ayan, nakamute.
Hi,
Okay,
I'm
okay na.
here.
Ayun.
Can
Oo.
you see me?
Yes po. Loud and clear, loud and clear.
Oh, okay. So I'm so happy and so privileged to be here. And thank you so much, Dr. Susie. Alam niyo ito si Dr. Susie, I could never say no to her. And I'm very, very happy to talk a little bit about children with cancer and COVID. So if I may proceed.
Yeah, go ahead, May.
Okay, so this afternoon, what we're gonna do is I'm gonna walk you a little bit about things about childhood cancer, and then subsequently present the baseline assessment for the country for childhood cancer control. And of course, because this is a Stop COVID webinar, I'm going to touch on pediatric cancer and COVID-19 and how do we move forward, not leaving behind COVID, but living with COVID. So just a bit of background, approximately 400,000 new cases of childhood cancer are diagnosed annually across the world. But in the Philippines, we expect about 4,700 to more than 5,000 new cases every year. And the most common types of pediatric cancer include your leukemias, your brain tumors, your lymphomas, and more than 80% of children are cured of cancer in high-income countries, but the same is not true in low-middle-income countries where less than 30% are cured. And childhood cancer is curable. As you can see here from the National Cancer Institute data, it shows that the overall survival for childhood cancer is around 84%. And the leukemias, the lymphomas, as well as Wilms tumor are the most highly curable cancers that we see in children, but overall more than 80% survival. Unfortunately, the same is not true for the rest of the world. And sometimes I think that how we survive cancer would also depend on where we are born. And if you see in this slide, overall 5-year survival rates for the different regions and countries across the world, the blue color show 75 to 100% survival. The red one is 0 to 25%. So as you can see, the Philippines is at 25 to 50% overall survival. So we approximate about 30% survival across the country for childhood cancer. Now we need to understand why there are lower survival rates in lower middle income countries compared to high income countries. And in this slide, you will see lower middle income countries where the Philippines belong. One of the biggest problems is we have a huge undiagnosed population. It's sad, but there's still a lot of children who do not even see a doctor or do not even see a specialist and be diagnosed with something that is actually can be cured. And the other problem in low middle income countries is misdiagnosis. And this is why this month, one of the things that we would like to do is create awareness for childhood cancer. If you think of 100 people with cancer, 90% of that is going to be adults, but and only 10 is going to be children. But this is very important in a country like the Philippines, where we have a relatively young population. So a greater awareness of childhood cancer, as well as improved capacity in diagnosis, will help bring up the survival rates for childhood cancers. Other things that we need to think about are patients who refuse treatment. Unfortunately, pediatric cancers, they suffer the poor reputation of adult cancers. When you hear the word cancer, you think most people think of this as a death sentence, but the same is not true for children. Pediatric cancer may be aggressive, but it is highly curable. And this is why the World Health Organization, together with St. Jude Children's Research Hospital, which is the collaborating center for pediatric cancer of the WHO, launched the Global Initiative for Childhood Cancer. And the goal of this initiative is basically to achieve at least 60% survival for childhood cancer globally, saving at least 1 million additional lives. And how do we intend to do this? By increasing the capacity of countries to provide quality services for children with cancer, and to increase prioritization of childhood cancer, not only in the global and the regional, but also in the national levels. Subsequently, there are national, regional, as well as global outputs that we would like to accomplish so that we could improve cure rates for children with cancer. And we have a strategy called the Cure All framework, which is based on the WHO building blocks. And Cure All stands for Centers of Excellence, Universal Health Coverage, Regimens for Management, Evaluation and Monitoring, Advocacy, Leverage Financing, and Link Governance. I will be talking more about this subsequently. And the WHO has chosen 6 focus cancers: acute lymphoblastic leukemia, Burkitt's lymphoma, Hodgkin's lymphoma, retinoblastoma, Wilms tumor, and low-grade glioma as the cancers of focus for pediatric cancer. If you see here in the right, this is our entry to World Health Organization All Hands in photo contest, and this was included in the WHO packet. Apart from the fact that the Philippines was chosen as the first focus country for pediatric cancer in the Asia-Pacific region in 2019, this was also the year when we had landmark legislations passed in the country. The first is the National Integrated Cancer Control Act, which has a council. I sit in the National Integrated Cancer Control Council. And then, of course, we have Republic Act 11223, called the Universal Healthcare Act. And the implementation of these laws has largely been derailed because of COVID, but work is underway. We have to start from somewhere, and there are only very few countries around the world which has cancer law. I can only think of Peru, which has a law for childhood cancer, and so that is certainly a milestone accomplishment for the country. And among the things that we have been doing is to do a baseline assessment of childhood cancer control in the Philippines. And this is a project that was done by the Philippine Cancer Society together with my society, the Philippine Society of Pediatric Oncology. Basically, what it wants to do is to look into the Philippine cancer health system and childhood cancer control using the global health system framework of WHO, with the 6 essential building blocks that are mirroring the pillars of the National Integrated Cancer Control Strategic Action Plan of the Philippines. And so this has several different segments that basically shows what are the current conditions, what are the identified gaps, and the proposed actions. For example, in service delivery, the study has shown that survival rates are from 30 to 50 from among the 6 index cancers in the country because of several factors. Delayed diagnosis, inappropriate treatment, abandonment of care, inadequate supportive care, and then gaps were identified and subsequently proposed action plans were presented, which includes defining a referral pathway from the community to the local government unit to the regional cancer centers for the 6 index cancers and all the other pediatric cancers. It is said that a path is made by walking on it, and so hopefully if we create this pathway, more children could avail of the resources that is being provided by the government. There's also governance and financing, where in the current situation, we are very, very proud to report the implementation of NICA and the Universal Healthcare Law. And then subsequently, we were also able to identify gaps such as fund delineation for the implementation of the Philippine Childhood Cancer Control Program. And we are proposing several action plans on this effect. And the other things for medical products and technologies, health information systems. Here, among the things that we were able to see was where are the children with cancer being diagnosed. And we saw that about 68% of these children go to public hospitals, about 20% go to private hospitals, less than 2% see a private doctor, and the others are diagnosed at death. We are also able to map out the health workforce across the country for pediatric cancer care, and proposed action plans include identifying strategies and training frameworks to train pediatric oncologists and the other members of the team. And of course, it's very important. I think the beauty of having a child as a patient is not just you are not only taking care of the child, but you are also concerned about the family and the community around this child. And we also tried to look into the social determinants of health that has contributed to why there are poor survival rates of pediatric cancer in the country. And we see that poverty, poor living conditions, as well as education are significant barriers to care. And we hope that by identifying these gaps and proposing action plans, we would have concrete paths that we can take to improve the cure rates of cancer in the country. And to me, this is quite a very interesting cartoon. Cancer is hard enough. you hear the word cancer, a lot of people will ask me, why are you a pediatric oncologist? Isn't that a very depressing specialty? So cancer is tough. When you add COVID-19 on top of it, it's like being stuck between the devil and the deep blue sea. And I think this cartoon is very appropriate to show this, to demonstrate this. And talking about COVID in pediatric cancer patients, there is this huge systematic literature review that was published in the European Journal of Pediatrics that used the grades evaluation on SARS-CoV infections, COVID-2 infections in pediatric cancer patients, and they analyzed 1,397 reports. Out of these reports, they chose 45 reports that included 1,300 pediatric cancer patients, and they tried to see what was the COVID experience in these children, and they saw that about 41% had mild to moderate course, 11% had severe symptoms, and chemotherapy was postponed in about 12.77%. 19% of these children received chemotherapy even if they were having COVID infection, and 25% died. The 25% of the deaths were potentially related to COVID-19. And the conclusions of this study was that there are favorable outcomes in pediatric cancer patients for SARS-CoV-2, but the morbidity is higher compared to children without comorbidities. So if you have a child with cancer and a child who doesn't have cancer, morbidity is much higher in a child with cancer. There are no severe complications associated to continuation chemotherapy, and subsequently you will see in my next slides that the recommendations is actually, as much as it is possible, we do not interrupt treatment for cancer. In fact, in my center, my Southern Philippines Medical Center became the end referral center for COVID in Mindanao, and I think we were the only center. The Cancer Institute was the only center that was not whose resources were not given up to COVID, together with the Women and Newborn Institute. So the risk of cancer progress or relapse should be weighed versus the risk of severe COVID-19 with fatal outcomes. So, what do you choose? A child who relapses or dies of cancer, and knowing that the risk for severe complications is not really very high. And I would like to show, I think a lot of the infectious disease consultants, or particularly the pediatricians, are familiar with this registry by the St. Jude Children's Research Hospital and the International Society of Pediatric Oncology. And as of 2 days ago, with 51 countries reporting in about 1,819 cases, based on severity, we see that about 34.9 or 35% of the kids were actually asymptomatic. 38.2 had mild symptoms, about 8.7 had moderate symptoms, and only 10.7% had severe symptoms. I think those were relatively similar to the previous paper that was presented. And with regards to patient status, majority of these patients actually recovered and were okay. And the Philippine Society of Pediatric Oncology conducted a similar survey among our members, and this was done by Dr. Luz Del Rosario and Dr. Rita Gonzalez Santos for the Philippine Society of Pediatric Oncology, and we were able to collect 54 patients, and 15 of these patients had delayed or interrupted treatment, but majority of these patients, about 65% of these patients, continued to have chemotherapy despite the COVID pandemic. And with regards to disease severity and outcomes, about 30% were asymptomatic, 26% had mild symptoms, about 24% had moderate symptoms. So almost half of these patients had mild to moderate symptoms. About 13% have severe symptoms. So this reflects what is being seen in international studies that was done at St. Jude in the paper that was published before. And majority of these patients also recovered from COVID. So locally, this was our data. From 2020 up to August, we have 170 cases of COVID among our children. And we had 29.4% deaths, but this is not all because of COVID. A majority of these cases died because of progressive disease. We know there have been several delays during the COVID pandemic, but majority of the patients survived, and there was actually very low abandonment among our patients. And this is the guidelines that was passed by the different pediatric oncology societies across the globe: the International Society of Pediatric Oncology, the Clinical Oncology Group, which is the North American group, the PSYOP Europe, PSYOP PODC, Pediatric Oncology in Developing Countries, and our partners in surgery and community. And the general guidelines, this was published during the start of the pandemic, and the general guidance for adapting cancer services and cancer treatment for the COVID-19 pandemic showed that the standards of care for diagnosis, treatment, and supportive care for children should not be compromised or electively modified during the pandemic, if at all possible. So we have to make all possible means to ensure that all the kids do not miss their treatment. And if the resource constraints mandate treatment modification, this should be done by a whole, not a whole service approach rather than individual clinical decision making, and should be endorsed by institutional governance. So for example, in the VAU, we abide by the IATF guidelines, and all cancer centers have to adopt anticipatory and planned process to adapt their service to potential resource limitations. We do want to limit patient visits. That's why we did a lot of telehealth consults and hospital admissions. Hospital admissions, we wanted to ensure that they don't stay in the hospital for a very long time, and we had to suspend many of our community activities such as Survivors Day, as well as other surveillance activities. And all elements of cancer treatment has to continue without modification. So no decreases in the dose, radiation has to proceed, so on and so forth. And to maintain a list of cases where care has been adopted, so that subsequently we can look and analyze on these cases. So I'm going to talk a little bit about vaccination, but I must confess that I'm not an expert in this. And this is taken from the Together website of St. Jude. And if you want to know the answer, yes, it is safe to give vaccines to children with cancers. So we initially started with our survivors, and then subsequently our parents, and then the children. And as you can see here, these are the recommended vaccinations. But it was also noted that even if you don't have these vaccines available, any available vaccine is okay, because the risks of having COVID and having severe disease or dying of COVID is higher if you are not vaccinated. And so what have we been doing? How did we navigate the devil in the deep blue sea, and, you know, having this World Health Organization Global Initiative for Childhood Cancer focus country on our neck. And this is not just us at Southern Philippines Medical Center. This is also Philippine General Hospital. This is Philippine Children's Medical Center, and all the pediatric oncologists across the country. And so I will go through the Cure All framework, CUREALL, and for Centers of Excellence and Care Network, as you can see, you know, from the very little things, from the guard opening the door, not anybody else, screening before they get into the center, screening for symptoms used to be, and then subsequently used to be RT-PCR. But right now, with a lot of people, what we have been doing, and I think this is one of the fantastic things that we have done in our center, is to have a dedicated infectious disease consultant that helps with our living COVID guidelines, living in the sense that, you know, it changes. It is very responsive to current changes. And I know that she has been your speaker in one of these webinars, Dr. Delta Aguilar. She's a fantastic infectious disease consultant. And as a Center of Excellence, we have been a St. Jude Global Partner, and we have been partnering with St. Jude since 2006. So we are the first partner in Southeast Asia, and they have been helping us in our capacity building and continuing quality improvement. So we have this center with 44 beds. It's a 3-story unit with 44 beds for children. During COVID, we have to bring it down to 20 so that we could establish the required distance per patient. And we also have to protect our healthcare staff. And if you ask me, among the heroes of pediatric cancer, to my mind, are the people in the shared care networks. There was a time that Davao had to lock down, and our patients are unable to access Southern Philippines Medical Center. But by God's grace, we were able to establish shared care networks across the island of Mindanao. They are located in Bukidnon, in Cagayan de Oro, in Tagum, in Butuan, and for a while there was also Zamboanga. And basically, we believe that if there are more people trained to care for children, more children will be cared for better. And so they are the literal frontliners during the COVID and the saving grace for many of our patients. They were responsible for acute care, for referral, follow-up, and they were homegrown teams that we trained at Southern Philippines Medical Center and returned to their centers, and we continue to communicate with them to this day. This was a World Child Cancer Project, and among, you know, I was when I think about this, so we received a grant from the Department of Health to work on the clinical practice guidelines on acute lymphoblastic leukemia and Burkitt's lymphoma, and we literally walked through broken glass for this project. But we were very, very happy to accomplish this, and this is now completed, and you can see this at the Department of Health website. So it's a clinical practice guidelines on ALL and Burkitt's lymphoma. And I'm very, very proud of the Southern Philippines medical team, the technical working groups headed by Dr. Jeannie Ong and Dr. Grace Pexon for ALL, and Jeannie for Burkitt's lymphoma. And we're also helping lead the regional study for Burkitt's lymphoma in the Asia Pacific region, together with with other countries in the Asia Pacific region, because not much is known about the kinds of cancers that we see in Asia. And this is where 80% of the children are. What we know are what we read from North America and Europe, but Asia is still a mystery place for pediatric cancer. And of course, universal health coverage because of the NICA law, the Universal Healthcare Act, and we're very happy that we were able to give PWD benefits not only for children but also for adults. And we're helping revise the PhilHealth Z packages. For health and information systems, these are the registries. So we have maintained a very simple registry ever since we started. It may be in Excel format, but we can easily migrate this. We are currently participating with SJ Care's registry as well as the profile study, which will help us evaluate and monitor the steps that we are taking to improve the cancer cure. And on the right are our dedicated data management team that is actually provided by House of Hope Foundation. And we started our fellowship training in 2018. This is because a lot of the places in Mindanao are still underserved, and we're very proud that we are the only training program outside of Metro Manila. With regards to financing, everything has a cost, and we have to find all means possible to support our patients. And being designated as an advanced comprehensive cancer center by the Department of Health, we are able to access the resources that are from government, such as the CSP map and the Cancer Assistance Fund, and of course the PhilHealth Z package. But over and above that, we know that being in a public institution, there are so many gaps. And so community and non-governmental organization support such as Kythe that has helped train our child life coordinators for the past year and has given us this perspective of caring for children with cancer. And of course, House of Hope Foundation for Kids with Cancer, which I founded in 2004 and currently is stepping in all gaps in the treatment of cancer, particularly the medical and non-medical needs. So if antibiotics run out, we buy this for the patients. If chemotherapy is not available, we buy it for the patients. If we need to send specimen for diagnosis overseas, we provide this for the patient. If the patient dies and wants to go home, we ensure that we are able to do this for the families. So this is House of Hope Foundation for Kids with Cancer. Unfortunately, because of our very limited resource, we're only focused in Southern Philippines Medical Center and the shared care facilities around us. And of course, we may be a unit, but we are also part of the whole. And so the Southern Philippines Medical Center Cancer Institute has this vision and strategy map for the whole institution, and that is for linked governance. And so in summary, pediatric cancer is a highly curable disease. COVID-19 infection in pediatric cancer patients has favorable outcomes, but higher morbidity compared to children without comorbidities. And the WHO Cure All framework is a systematic approach to achieve comprehensive cancer care and cure for children with cancer. And I would like to end this talk by saying that we may never change the world, but we can make where we are a better place one day at a time. Thank you. That's my email, and I'll be happy for questions.
Naku, galing-galing naman itong si May. Palakpakan naman natin
Galing.
yan. Grabe. Thank you so much, May. Wala ba tayong ano?
Yun. Okay.
And May, thank you all the heart and clapping from our audience. We really appreciate your presentation. I think the thing about May's presentation, it is so much, apart from being very makikita nyo, galing talaga. We're so proud of you at SBMC. May, no, talagang world class eh. And she really gave you all the international data. But at the same time, you can feel her heart, no? This is her life work and her passion. So thank you so much, May. Stick around because we're gonna have some more. May Q&A tayo mamaya. Raymond, ikaw naman.
Yes, thank you. Thank you. Likewise, thank you, Dr. May. Very comprehensive po and really trying to emphasize the fact that children with cancer, they need our help and we should be able to extend as much help as we can, especially in light of the challenges brought about by COVID-19. As a reminder, to everyone, sa Q&A po natin, we'll be choosing those who are the most, the questions that are the most upvoted. So we encourage everyone to start typing in your questions in the Q&A section or in the comment section of the Stop COVID Deaths or TVUP Facebook pages or in the TVUP YouTube channel. Okay. For our next presenter, she is the Child Life Officer for Visayas and Mindanao of the award-winning Kythe Foundation, one of the pioneering programs for children with cancer. It started as a volunteer organization from Ateneo, and it's now a national organization. Please welcome to your screens someone who's based in Cebu for the very first time po, Miss SHALOM Rhea Bernales. Miss Xiao?
Yes, good afternoon, Dr. Raymond. Good afternoon, Dr. Susie, and good afternoon to our viewers in YouTube, Facebook, and here in Zoom. I would like to share my screen.
Go ahead, go ahead.
Yeah. So this afternoon, I would like to share with you the program of Kythe, the services that we offer to our pediatric cancer patients and our kids with chronic illness, as well as how we can help to our kids with chronic illness. So let me start my orientation or presentation with this picture. So when we think about children, you can imagine them playing, you can imagine them going to school, being with their friends and their family. And these are the faces of the children we often see. But when the child gets sick, imagine a child being sick. There is anxiety, there is stress, and there is fear. And these are the faces of the children that are chronically ill. The stress and anxiety is not only felt by the children, but also by the parents. And these are some of the effects of being diagnosed with a chronic illness to a child. There's possible delays in age-appropriate skills. There's hospital stays, prolonged hospitalization, sometimes 2 to 3 years, separation from the family. There's you have issues of death. There's issues of control and uncertainty. There's fear, there's anxiety, there's stress, feeling of being different. When the child is diagnosed with cancer and they undergo treatment, but they lose their hair, they have sometimes physical disability, there's symptoms of discomfort or pain. And there's also effects on the family. So there's altered and strange family relationship. Siblings will feel left out. There's time pressure, financial worries. And when the child is confined in the hospital, the experience can have many adverse effects, and more so for children with cancer and chronic illnesses, as they need to repeatedly go to the hospital, sometimes every day, sometimes weekly. And these have effects on the child. And this is where the Child Life Services come in. So the Child Life Services is a therapeutic service designed to address the psychosocial needs of pediatric patients that accompany healthcare experiences. These are therapeutic services designed to address the psychological, the social, and intellectual needs of the pediatric patients through interventions that include play, education, there's preparation, support, counseling, and patient orientation to help decrease the stress and anxiety experienced in the hospital setting. And we are doing that first and foremost by helping them understand what is going on, what is happening. Because when kids are unable to cope with their sickness or with their illness, it has a long-term effect which can even affect them even in adulthood. And in the Philippines, the only organization that provides the child life services is Kythe. So Kythe is derived from a Scottish word. It means to make known or to manifest. And we manifest our love for the children through simple sharing and togetherness. And Kythe rhymes with kite because we uplift and provide hope to the children and their families. So we are in 13 partner hospitals with at least one full-time paid staff, sometimes two, with a pool of volunteers who help us with our work. 30 to 40% service to pediatric patients in each of our hospitals, and majority of which are primarily children with cancer and secondary with chronic illness. Kythe continues to do what it does because of our mission and vision, and that is to inspire hope, to create a culture of caring, and to make hospitals a happier place for children. I would like to share with you how we do the child life services in the hospital. And we have an acronym for that, so you can easily remember the child life services. So it's PETAL. So P is for play, E is to educate and prepare children, T is to tend to emotional needs of the child and the family, A is to assist during medical procedures, L is to lend medical, financial assistance, and S is to support parental involvement or empowerment. And I will explain each service as we go along. So this was how we did the child life services. So P is for play. Play is a language of children. It influences a child's ability to be adaptable, to be resilient, to cope with stressful events, which enables them to support their own well-being. Medical play is hands-on play experience using real or pretend medical equipment and supplies to help children become more comfortable and familiar with healthcare experiences. It makes the unpredictable events more manageable, and it provides opportunity to work through their feelings and fears, and it enables the child to plan and rehearse coping strategies. E is education and preparation. Preparation is the process of communicating accurate and developmentally appropriate information, identifying potential stressors, as well as planning and practicing coping strategies. So our favorite example of a coping strategy is breathing or deep breathing techniques. So we have box breathing or the 5-finger breathing technique, or sometimes it depends on the child. Sometimes we do singing or counting. And these activities may offer insight into the patient's level of understanding of the healthcare events and provides the opportunity to clarify misconceptions and opportunities for expression. So an example is chemotherapy. So depending on their level of understanding, we can ask a child, what do you think what chemotherapy is? So, or what is CT scan, or what is the sickness. So we often clarify misconceptions, since most of us know that chemotherapy or cancer itself has a lot of misconceptions. And this not only applies to the children, but also to their parents. So that is why education is very important, not only to the family, but also to the patients as well. So these are some of the materials that we use to explain and to prepare the child. So we have a medical doll and also have a CT scan machine. So we also is to tend to emotional needs, not only to the child, but also to their families. And A is to assist during medical procedures. So we are there when the child undergoes intrathecal or bone marrow procedures, and we do the coping techniques with the child. And S is parental involvement. L is lend, financial and medical assistance. So we have the share of fare, the adopt a patient, and the tithe for Kythe. And S is to support parental involvement or empowerment. So there are only a few of us in Kythe. There's only 12 of us for the whole of Kythe. That is why we want to multiply ourselves to the parents. So the parent programs empowers the parents. We have parent educations through Zoom or Facebook Live, and we have parent summits. We also have the parent kapihan, wherein it's a monthly kamustahan with the parents, and we have grief and bereavement sessions also. So even with the pandemic, these programs continued through different online platforms. And then the pandemic happened, so we also had to pause for a bit, but Kythe has transitioned well in providing the child life services despite the pandemic. So instead of doing face-to-face sessions, we have tele-child life sessions. So it can be individual or we do it in groups. We also digitize and animated resources. So with the help of volunteers, we have digitized and animated stories, play activities, preparation, and education materials that we use during our tele-child life sessions. These are some of the online games that we use when we do one-on-one or group tele-child life sessions. We also have the other programs. We also have a teen program, since the needs of the teens might also be different from the needs of the little kids or the little ones. We also have survivor program, also have the mental health program, as well as the continuing education for the staff. And we also have the other programs. So we have virtual Celebrate Life parties. So we did a virtual Santa Cruzan, we did virtual Halloween party, and we have gift giving, food distribution, and also company CSR activities. And then our other Kythe programs. So we have personal activity kits, since we cannot be there physically in the hospital when the pandemic happened. We did individual activity kits for them so the kids can have activities while treatment. We have the hospital kits, and we also have volunteering opportunities. So to end my presentation, we in Kythe continue to do what we do, because for us, every child has a right to learn, play, and grow even when confined in the hospital. Thank you and have a good day, everyone.
Wow, another excellent presentation. Palakpakan naman natin uli yun. So proud to see, sana yung ating palakpakan? So proud to see all your work. That's amazing. Ako, Raymond, din ko lang sa mga books, I'm blown away by it, no? Parang that we're producing all of these for Filipino children. I think everybody needs to know this, no, na hindi lang yung ikikimo lang, pero yung buong pagkatao ng bata ay binibigyan natin ng kahalagahan, no, yung feelings nila, yung parents nila. So really so amazing. Congratulations, Xiao and to Kythe, and we're all very, very proud of you. So, Raymond, we're going na
Thank
to
you.
our
Thank you, Dr. Susie.
Sige, ikaw na mag-transition, Raymond.
Correct. Thank you, Xiao, and to our Kythe colleagues po, no? But before we go into our Q&A session, we'll take a very quick break for a special public service announcement today.
Aloy, bilisan mo! Dali! Wala!
Ha? Ano nangyari? Ba't hindi kita makapitan?
Handa ka na ba, Kaloy?
Oo naman, ate. Nabakunahan na kami. May powers na kami laban sa inyo.
At hindi nyo na kami basta-bastang makakapitan. Yay!
Sisiw!
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP. The COVID communication public service announcement is one of the many creative outputs of the Stop COVID Deaths to push for pediatric vaccination for children age 5 and above. We hope you'll be able to share this message and this video clip to all of your social media. Stay safe and stay well. Magpasama na po sa Bakuna Center. We also understand that everybody's very busy, so we have selected presentations that we will feature in its entirety, but these are very short consumable ones. We lovingly call them SED shorts. Please feel free to watch them at your own convenience at the TVUP YouTube channel. So go to youtube.com/TVUPPH. Maikli lang po ito, and we hope you'll be able to gain the nuggets of wisdom as mentioned in these short videos. Over to you, Dr. Susie.
Okay, thank you so much. Okay, we're going to ask May and Shao to open their cameras. We're going to have a discussion. I think Raymond's already picking up questions from the audience, but just to get the ball rolling. And again, no, Shao, ang ganda ng mga materials, no. Parang naisip ko maganda yatang i-feature sa ano yan, sa Signal 1 program natin. Storytelling using your books. No, so I think some of the topics would be really relevant even to other conditions, not just to cancer. Anyway, so just to start this discussion, so both of you, May and Shao, right? You're dealing with ups and downs of both the patients and the parents and the families, and you both indicated that it's not easy. I know from experience also that many things are unpredictable. When things are looking good, maybe then they're not looking good, and so on. So I wanted to ask you a more personal question so that our audience who also deal with children with illnesses can learn a little bit about how do you cope emotionally with some of the very difficult situations that you face. So I'm sure you have had patients where the outcomes were not good, okay? And you invest a lot of your time, a lot of your energy into helping, and yet hindi pa rin maganda yung outcome. So how do you cope? Kasi I think our audience could learn from that. I think really children with cancer is a very difficult area. Because just as May said, no, just the thought of a child having that kind of condition is difficult to think about. What about dealing with the downside of it, no? So how do you cope? May, ikaw muna. Kasi may bubbling ito, tsaka very positive eh. Pero May, how do you cope with that difficulty?
Alam mo sa medical school, di ba, we've been trained to, have this parang professional distance na with our patients. And I think that is, in a way that is okay. But for me personally, ang belief ko is that kung hindi mo ma-experience yung grief, hindi mo rin ma-experience yung joy. Alam mo yon, yung I think it's normal for us to feel sad, to go through grief if we lose a patient. Kasi unlike siguro sa other specialty, we have had kids na mula pa baby na sa amin eh. Alam mo yon, yung we share long journeys with them. Hindi lang dun sa kids, but also the families. So I think it's normal to feel sad, no? But it's also very important to get a handle of your feelings. Pero I will tell you my mistake ha, yung unang mistake ko talaga.
Sige, maganda yan.
There was this patient na I lost. Tapos talagang, alam mo yon, you tried everything, no? Pero siguro hindi talaga siya akin or hindi talaga siya meant to be. And eventually, I lost that child. Alam mo, no, mas malakas pa yung iyak ko kaysa parents.
Yeah.
And then, I think we shouldn't do that.
Yeah,
Kasi
yeah,
I
yeah.
mean, you have to be there for them, you know.
Yeah.
And that's why I think pediatric oncology chooses the people, no? Yung there's a breed of people that are, you know, made for pediatric oncology. Siguro Sterner staff, no? Kasi it's very important na unahin mo yung needs nila before yung needs
Right.
mo.
Yeah,
But for
you're
us being but for us being human, 'di ba? You know, you lose somebody syempre. So but there's a time and place
Yeah.
ano, for those grief, no? Ako I cope because of the people around me, no? Yung mga colleagues ko, even the families, the parents, the people I work with. Kasi it's a shared burden eh. Hindi mo siya karga na ikaw lang. You know, you have the team around you, and ako I gain strength from that. And Dr. Susie, it helps na sometimes, kaya paminsan-minsan ma-realize mo, oh, I stepped out, umalis ako, or something like that. Because sometimes you have to remove yourself. Yung tawag namin dito, you need to remove yourself from the dance floor. You go to the balcony so that you get a better perspective of what is happening. But I think the real secret of happiness or even of joy, na hindi lang sa pediatric oncology, but even in life, is really that attitude of gratefulness.
Okay.
Alam mo yan, yung to be thankful for all things good and bad. No? And ako kasi I'm an optimist eh. I always try to see, I told, yung isa ko, I was trying to teach this young pediatric oncologist that I was training. Sabi ko sa kanya, imagine kung wala ka dun. Kasi, you know, she felt, it was a good thing that you were there. No, kahit nawala yung pasyente, your presence meant a lot, not only to that patient but also to the family. So you know, yung mga things na kasi paminsan-minsan masyado tayo nagfo-focus and even like you know, when we look at data, we just look at numbers. We forget that there is a child behind that number. Alam mo yon, yung and then we talk about outcomes, but we hardly talk about quality of life. You know? Kahit sabihin natin 5 years old lang siya, pero yung life niya was full. And I think I would like to segue to Xiao, because this is basically what they do, and I've learned so much from Kythe. Thank you very much.
Thank you, May, for that very personal sharing. Xiao, kayo, no, you put in a lot of positive energy into this, and yet, you know, we know that not all things turn out as you would like them to. So how do you cope with this?
Well, like Tokme, it has also been very challenging. I've been with Kythe for the past 14 years, and I've met a lot of patients. And I guess one of yung personal experience ko was when I started with Kythe, I was invited to the first birthday party of my patient, of our patient here. And ako yung host, and ako yung nagpa-games and everything. And then he was not able to turn 2 kasi we lost him, you know, the year after. So I was devastated, and like what Doc May said, na, you know, it's natural to be sad, because as much as we would want to put a line between patient and our personal life, it's very hard, especially when dealing with kids. And I guess in my personal experience, being thankful to be with them in their journey, and being thankful to be with them at their most difficult and most vulnerable time is a blessing. And that is what I always put in my heart and in my mind when I need to cope with the loss, or when I need to cope with being in a difficult situation with the family. And sometimes I also parang go out then and do self-care. That is very important for us. And for Kythe, we are very supported by our teammates. Like we also do the same services that we provide. And every month we also have or we also have opportunities to really talk to like psychologists or even to our peers because they can understand what we are going through. So yes, that's how I was able to cope for many, many years when working with children and their families.
Thank you so much, Shaw. Okay. Raymond, let's go to your questions in the Q&A or in the chat box. I saw some interesting ones. So,
There's
so go
one
ahead.
from in the chat box, Dr. Susie will post it to Dr. May. How can we best explain childhood cancers to the peers of patients without inciting overreactions, anxiety, being overprotective, to the point of exclusion of these patients po? I saw you type in your answer, Dr. May, but perhaps you could expound on it, especially for those who are joining us outside of the Zoom.
Well, ang suggestion ko, number one, don't start a lecture. You know, tayo kasi paminsan-minsan, ganito, ganyan. I think it helps na to understand where the questions are coming from. Bakit sila nagtatanong, no? And tayo paminsan-minsan, and I'm also guilty of this. Tayo kasi mga doktor paminsan-minsan kinakabog natin yung mga nakikinig sa atin with big words. Or you know, I think we just have to keep it simple and to also ask questions kasi paminsan-minsan may mga pinanggagalingan yung mga question ng classmates or question ng other parents. So, you know, they cannot be as simple as they can be kasi paminsan-minsan and you're able to address their concerns more effectively kasi like bakit siya may walang buhok or you know, when they ask that, and then you know, bakit, you know, why do you ask, or bakit kayo nagtatanong? Kasi sometimes baka mahawa ako, so you know, you get to answer the concern directly. Hindi yan nakakahawa, hindi rin malagas ang buhok mo pag nakikipaglaro ka sa kanila. So you know, in a way your answers are more directed to kung ano yung gusto nila talagang itatanong. So, and just have to keep it as simple as possible, and to also ask questions para mas makasagot ka ng mabuti. It's a process. It's something I've learned for I tried to learn for a very long time, and I'm not still very good at doing it.
Oo, yun ang talagang the art of medicine, no? Parang it's not all the facts and the science, no? A lot of it is yung empathy with the patients, with the parents. And I like what you said about trying to understand where they're coming from. Kasi sometimes we assume na yung alam natin, alam din nila. Pero actually, hindi di ba? And it really takes a lot of, I would say, experience and mentoring. So I'm sure you're training all these younger doctors how to listen, know how to listen to the parents and to the patient. Raymond, meron pa ako nakitang isa. Teka.
Sige po, go ahead, Dr. Susie.
Sa Q&A, saan ba yun?
Is it Q&A or is it
Sa chat ko rin nakita Parang there was a question about ako na lang magtatanong muna, hindi ko makita Hindi ko makita.
I have a question then, pero go ahead, Dr. Susie.
Sige. So I think this is for both of you, no? For May and for Shao. Okay, so COVID-19. Okay. What is your experience with the families? Are they, you know, all the misinformation going around about vaccinations, are we seeing very good compliance with the vaccinations for these children? Or is your experience natatakot silang magpabakuna? May, ikaw muna.
Ako muna. Sabihin ko sana si Xiao muna kasi kanina pa ako salita.
Sige, Xiao.
Xiao, ikaw muna.
Oo. Ay, nakamute
so
ka,
far,
Xiao.
hello, Doc?
Sige, go. We can hear you
Yes,
now.
Doc. Okay. Okay. Here po in Cebu, so far, initially, I think like everybody else, then parang natakot. That was the initial reaction, fear of being vaccinated. Most of the parents were really scared kasi nga most of the kids were still having treatment. And di ba, madami ding mga parang fake news online na magiging, parang magiging zombie or anything. So fear talaga, that was the initial reaction of the parents. But slowly, we also tried to educate the parents. We did the Facebook Live and a lot of parent education. I guess that's one of the strategies that we did then to educate the parents para not only to address their fear, but also to address the misconceptions that goes with vaccination.
Oo, tsaka sinabi rin ni May kanina di ba? Yung chemotherapy continues even if the child has COVID, no? So May, what's your experience on the vaccination side?
Same as Xiao, syempre may hesitance talaga yun. And so many things around. Kami kasi, di ba may House of Hope kami na transient home. So we have kids there. So I try to find the time to really talk to kahit doon sa outpatient, doon sa lobby, if you remember my doon sa lobby, I would sit there and I would talk to the parents. Para naman kasi I would rather na ako yung tanungin nila kaysa magtanong sila elsewhere. And if I do not know, I also tell them that I do not know. But I think the important thing is, I think a good example. So I will tell them that I have had vaccination, okay lang naman ako, lahat kami vaccinated. Tapos imagine kung halimbawa ang pasyente mo hindi siya mabakunahan, no? He might have severe illness, ma-delay ang treatment, no? So, as I have mentioned earlier, you have to weigh the risk of getting COVID and having vaccination and all that. So I think it's very important to have open communication with the families kasi hindi mo alam ano yung mga, sometimes you give a spiel pero actually in their minds ang dami-dami ng kung mga mga naiisip yan. So I think it's very, and ang pinaka I think yung maganda kasi sa amin, meron kaming regular talaga, whether face-to-face or online, every week, nagmi-meeting talaga ang lahat ng staff. So, nurses, doctors, lahat.
Yeah, good point.
Tsaka, we try to show a united front. And then when we communicate, pare-pareho yung sinasabi namin, walang nagsasalungat. No? So it's very important na consistent yung team to what they are telling the families. And sa akin talaga hindi ako magpayag na nasa CCI sila, hindi sila magpa-vaccinate. Yung staff yung healthcare workers. Syempre ang mga parents, syempre you need to do a lot of convincing kasi meron talagang ayaw which I will respect, pero when you talk to them and when they are able to share with you, I think mas clearer sa mind nila. I mean, siguro naman ikaw versus a neighbor mas reliable. Information mo.
Yeah, the role of the health worker actually in many things, no? The advice that's given by the person in white is really very, very powerful. But I really like what you said na you have regular meetings so that all the staff say the same thing. Importante yun Di ba? Kasi baka may nagsabing iba, tas may nagsabing iba. Lalong makukonfuse, no? So I really like that idea. Raymond, I think you wanted to ask something, but I saw something in the chat too. Go ahead.
Okay, so while you're looking for the one in the chat, Dr. Susie, this question I'll ask to Dr. May. Have you encountered po ba evidence with regards to, obviously we're talking about COVID-19 and the vaccine as an offshoot of the discussion. Have you seen evidence, kasi it's a phone-in question, ma'am. Have you seen evidence of children having blood cancers and then also having a higher chance of developing MISC as when they receive the vaccine, Dr. May?
Ang problema kasi cancer is not very common. So having a blood disease and the complications of the vaccine, parang you really couldn't tell. Mahirap i-establish is it because of the leukemia or is it because of the vaccine. So I have no kahit anecdotal na nalaman na there is such a thing, no? But maybe I haven't read everything, so baka meron doon, or maybe there are things that are not reported. But here again is yung anecdotes, no? Kung anecdotes lang yan, na story isang story, it does not pass on as a general truth for everyone, kasi bawat bata iba-iba yan iba-iba ang response nila to treatment, to the disease, and to other things. So yun, I mean that's my answer to that question. I hope I have answered it.
Yes po.
Yeah,
Yes.
thanks,
Dr.
May.
Susan?
There's in the Q&A box, no? Can blood donation help these children with cancer? I'm wondering how people can help besides financially. Oh, ganda naman nun, di ba?
Maganda.
Magandang tanong yun. May, anong sagot natin dyan?
Yeah, definitely. Kasi in fact, we go through blood drives. Kasi during COVID, talagang hirap kami. I mean, kulang na lang siguro i-bleed ko yung sarili ko. Kasi, di ba, regular yung blood donation drives before. But because of COVID, talagang na siya. I would encourage people to donate blood. If you're healthy, if you're qualified, please go ahead and do it. Hindi lang kasi yan sa pediatric cancer patients who knows one day it can save your own life, no? Or people you love, no? So
Yes.
I think that's a very noble. It's a very noble undertaking, and I would really encourage and appreciate that.
Mag-donate na daw kayo, sabi ni Dr. May, gusto niyong tumulong. Di ba? Oo, mag-donate na kayo. Ito pala, Raymond. Can newborn screening or something po detect cancer earlier in children? So I think one of the things you said earlier, May, was that a lot of kids don't even get diagnosed. So I think part of the question, so sabihin natin, the question is about newborn screening. But I would say, what would you say are also early signs or symptoms that would alert the health worker na baka they're dealing with some kind of cancer in children para ma-refer nila?
So let me first, so there are two parts of the question, right?
Yeah.
So yung first, with newborn screening, I don't think so, no? We won't even recommend, we don't recommend that for cancer screening. These are for mga newborn, hereditable diseases, but not cancer, unfortunately, no? There are certain cancers na may markers, no? For example, yung mga germ cell tumors mo, no, na you can do with alpha-fetoprotein, beta-HCG, but hindi lahat yan. And in the very young, that is also inaccurate, no? So baka ma-misdiagnose mo rin. So that's the first question. Yung early signs and symptoms, alam mo, ang problema natin paminsan-minsan is itong fear din ng public, no? Kasi yun na nga, sabi ko, kawawa naman kami yung pediatric cancer na pag narinig nila yung cancer, parang takot na sila, they won't even come. Ang problema talaga namin is really patients, if they come in late stages of disease. And we know that if we see patients early, mas higher ang chances na ma-cure namin yan siya. So anong pinaka-common? Leukemia, for instance. Unfortunately, ito naman, they resemble other pediatric illnesses, right? Fever, no, pamumutla. But it's when you see the constellation of symptoms like bruising, yung pantal-pantal, may fever, and then may mga malalaki yung mga lusay-lusay. that's something that you have to bring the patient to the doctor immediately. Kasi kung hindi siya cancer, fine, right? Pero kung cancer siya, at least maagapan siya. Number 2, yung mga bukol sa buto, bukol sa tiyan, no? Or even yung mga abnormality sa mata. We call that cat's eye, no, in a child who is quite young, less than 5 years old. Pag makita mo na puti yung isang mata, no, or puti yung dalawang mata, that's not normal. So what I would like to say is there has to be, kasi hindi naman yan siya ma-diagnose outside of the hospital. You have to bring these patients to see a doctor, and the doctors are the ones, to refer accordingly. We do a lot of education din sa other doctors because cancer is not very, very common. So nami-miss din ito ng mga ibang doctor. It's not their fault, no? Kami, syempre, every day we see like 40 people, 40 children na may cancer naka-admit. So, we know what these are, but the other doctors, they hardly see those ones. So, that's why yung sabi ko, one of the things I would like to do is, to create referral pathways na halimbawa makita siya doon sa barangay, saan siya dalhin, no? Sino ang kausapin, because I think that in itself will help a lot for the early diagnosis. This is the other thing. Childhood cancer hindi siya preventable, no? Our main strategy is early diagnosis. No, unlike yung mga adult cancers na huwag ka mag-smoke, huwag ka uminom, no, in children it's very it's different. Kaya ang strategy namin is early diagnosis. That's why we do all of these awareness things. No, we talk to the public, we talk to our fellow colleagues, no, and then we tell them what to do. If you see these children, what do you do with them? Where do you bring them? No? So those are the things that we do.
Thank you so much, May. Raymond, you've got a question for Xiao?
Yes, the question po is, so Ms. Xiao, if you had the chance to talk to your local chief executive or your lawmaker, what would you say or maybe request or advocate for potentially as the top needs for patients, your children po with cancer?
Thank you, Doc. So siguro from the perspective lang of the services that we provide, I guess I would always advocate for the child life services or providing these child life services to the hospitals. I mean, especially in major children hospitals or even in, district hospitals or any other hospital, as long as there is a child. Because, the child life services might focus on cancer patients or chronically ill children, but other children also need these services because other kids or kids do not have chronic illness are still scared to go to the hospital. They're scared of the nurses and the doctors. The parents are also scared of going to the hospital. The compliance and even the misinformation, misconception of the sickness. So I would still advocate as one of the needs for pediatric cancer patients is the provision of the child life services because we complement the doctors, the pediatric oncologists in their treatment to the physical sickness of the child.
Can I add to Xiao?
Yes, go ahead po.
Sometimes we forget children are not little adults. Ang ginagawa kasi ng mga hospital, pinagsasama-sama nila
Correct.
yung mga bata at saka matanda. Kahit doon sa radiotherapy, di ba? I remember this one time na may bata na for radiotherapy. Katabi niyang dalawang matanda. Nakahiga siya sa stretcher. Pagkatapos, it was so a dark and scary na lugar. No, so I think if you have pediatrics patients, you have to make it as non-threatening and as child-friendly as possible. No, that's why child life is very important. In fact, I hindi lang yung psychosocial sa SPMC, we even have a school. No, we are working with Department of Education. Binigyan nila kami ng teachers because our patients, despite undergoing treatment, they continue to go to school kasi there's life after treatment, right? There's life after cancer. Ayaw mo naman na yung mga classmates mo, yung mga friends mo, 'di ba? Ahead sila ng 1 year tapos naiwan ka doon. You have to make friends with other kids na naman. What if you lost your leg? What if you lost your eye? 'Di ba? That's terrible to be in a environment na hindi ang angkop sa iyo. So those are the things na I would ask for children.
Nice. Okay. All right. I think we can go, Raymond, to the answers to our fun quiz.
Correct, Dr. Susie. Thank you so much. What we usually do here, Dr. May and Xiao, is to have the speaker po give the correct answer so that the audience can hear it directly from our speakers. For our first question, how many new cases of childhood cancers are estimated each year in the Philippines? Dr. May?
So the correct answer is actually 4,700. So galing ng 67%. Yung others, that's fine. It's always an opportunity to learn. On recent count, this is more than 5,000 already. I think it's 5,178. It's just an approximate number based on the population. Yes.
Okay. For our second question, safe po ba ang magbigay ng COVID-19 vaccine to a child with cancer?
I love this group. Talagang napakatalino. Hindi ko pa na-lecture. Alam na nila. So that is correct. Yeah, it is safe to give vaccines to children with cancer because, the risks of not giving it or the consequences of not giving it are higher compared to having the vaccine.
Okay, thank you. Number 3. In providing support for children with cancer, PETALS stand for Xiao?
Yes, yun, petals is tama to. P is for play, and then E is to educate and prepare. T is to tend to emotional needs. A is to assist during medical procedures. L is to lend medical assistance, and S is support parental involvement or empowerment. So that is petals po.
Letter B po. Para
Letter
lang po for those who are wondering kung anong letter. Yung letter B po ang tamang sagot.
Yes, it's letter B for petals.
Thank you. And then for our final question, also for Xiao, sino po ba ang dapat nangangalaga ng mga batang may cancer?
Yes, tama po yung sagot ng 100%. Oh yeah, all of the above. So it's not just the responsibility of the doctors or the community or the government or even the parents. It's everybody's responsibility, and it takes it takes a community to cure a child with cancer. So it's all of the above. Yung sagot po, Doc.
Thank you so much, Dr. May and Xiao. And I hope ang ating mga ang ating mga attendees were able to take note of the correct answer specifically as it is shown on the screen.
Maraming mga heart, Raymond. Ayun, no? May mga heart.
Yes, so yan po. Buti. Sana po na maalala po nila even after this webinar, or you could also watch it in the playback para po mas malalaman po maintindihan yung ating pinag-uusapan. Right now, we will be launching our panel discussion poll. This evaluation poll ay nag-iisa lang po. Wala po kaming hiwalay na sinisend out after this webinar. Ito na po iyon. So we strongly encourage everyone to send in your feedback for this webinar. It consists of 5 questions. It is a 4-point Likert scale for each question. So habang binabasa ko po ito at sinasagutan ng ating audience, to our speakers, Dr. May and Xiao, please take the time to formulate maybe 1 or 2 sentences that will represent your final messages to our audience. Okay? So while you're doing that, I'll read off the list. Number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And number 5, the panelists contributed to new perspectives and knowledge on managing various key health issues. We will not be closing this panel discussion poll until the end of the program as we move on to the final words of our speakers. Dr. Susie?
Okay, so we're going to give both our speakers a few minutes just to give their parting words to our frontliners who have been so appreciative of your sharing today. So we'll start with Shao. What's your final message?
I guess, my final message to our viewers is my favorite parang tagline of Kythe, and it's everywhere. It's even at the back of my background. So for us, with Kythe and providing the child life services, we continue to do what we do for the past 30 years because of this tagline. Because for us, every child has the right to learn, play, and grow even when confined in the hospital. Thank you, Doc Susie and Doc Raymond.
Thank you very much. Okay, so we go to May. May, ano parting words mo?
Well, 2 sentences. First is, thank you. Thank you very much. This has been such a wonderful audience. Nakaka-inspire po kayo. And if there is anything that you have learned this afternoon is that childhood cancer is curable, especially if diagnosed early and treated appropriately. So thank you very much. Yun lang po.
Thank you so much. That's May Dolendo of SPMC all the way in Davao. Okay, now we're going to our recap summary by none other than our Deputy Director for Operations of the Philippine General Hospital, Dr. Stella Marie Jose. Stel, go ahead.
Good afternoon, everyone. As usual, we have a very good presentation from our speakers, and we are all privileged to hear Dr. May Dolendo and Ms. Shao Bernales. In the talk of Dr. May Dolendo, she mentioned that in the Philippines, there are 5,700 children with cancer, and most common is leukemia, brain tumor, Burkitt's lymphoma, and retinoblastoma. In the National Cancer Institute survey, she mentioned that the 5-year survival is 84% survival rate. However, she mentioned, and I think this is a very crucial part of her lecture, how we survive depends on where the patient lives. So overall 5-year survival is 75 to 100%, but in the Philippines, our survival rate is a low 25 to 50%. Why is this so? So she mentioned that in low income, low and middle class income countries, we have a very huge undiagnosed population. Some children do not even go for consultation to a doctor. Some are misdiagnosed and some have no diagnosis. So the WHO has a global initiative for childhood cancer, and the Philippines was chosen as the first focus country for cancer. Also here in the Philippines, we have laws for cancer, and she mentioned the universal healthcare law. However, there are identified gaps in this in our system. So lack of funds, lack of political will, lack of knowledge, and she encourages family and community engagement. So it is not only the doctors who should support the patient, it is the whole community. Now, in a study, SARS-CoV-2 and pediatric cancer, a systematic review, the conclusion of this study was a favorable outcome for pediatric cancer patients. However, morbidity is increased compared to children without cancer, children with comorbidities. So there's increased morbidity in children with cancer as compared to those patients without cancer. There is no severe. So when we have to balance, so because there is no severe complication associated with the continuation of chemotherapy. We always think that giving chemotherapy would be deleterious to the patient, no? For example, the layman because of the symptoms during chemotherapy. But she said that we have to balance the complication, severe complication associated to continuation of chemotherapy versus and also the risk of cancer progression and relapse versus severe COVID with fatal outcome. I think that's a very important message. And Dr. Dolendo said that when her patient passed away, she also cried. That also happened to me, and I was crying with the relatives. I think that is part of being a doctor. You have empathy for your patient. Now, I just want to highlight the general guidelines because this is important. The general guidance for adapting cancer services and cancer treatment during the COVID-19 pandemic. So the standards of care for the diagnosis, treatment, and support care for children with cancer should not be compromised or electively modified. No? Hindi babaguhin. Kung ano yung protocol, we should follow that. If resource constraints mandate treatment modification, this should be done by the whole service, a whole service approach rather than individual clinical decision making. And this should be ideally endorsed by the institution. Okay, all cancer centers to adopt anticipatory and planned process to adapt their service to potential resource limitations. So let's admit that there are resource limitations for all, and we have to limit patient visits to clinics and hospital admission temporarily. And we should suspend surveillance and survivorship clinics. So we have to limit their exposure in the hospital. All elements of cancer treatment should continue without modification unless resource become overwhelmed. And we should maintain this of cases where care has been adapted and develop prioritized approach to review care when normal service capacity resumes. So these are all very important key points that I think we as doctors should remember. Now, I also like the presentation of Shalom Bernales. No, Miss Shalom Bernales, you have inspired all of us. What is the effect of cancer on the child? Okay, on the child. Okay, so there are possible delays in age-appropriate skills. No? So they get, for example, they delayed skill in walking or talking, especially in young babies. Hospital stays and separation from the family, and also they face issues such as fear of death, lack of control or uncertainty, and of course the impact of medical appointment, treatments and procedures. Sometimes the patient when they see the hospital they start crying already. And what is the effect of this on the family? You have time pressure, and of course, sibling will feel left out, and altered strained family relationship, fear and anxiety, and of course, the financial worries. To add it up, there will be a period of grief when there is loss of a family member. Now, specifically, what should we do? We should reduce stress, anxiety, fear, and pain on the patient. We should promote healthy coping and adjustment to healthcare experiences, and we should ensure continued positive development of the children. So this is where Kythe came in. So what does Kythe mean? It is literally it means to reveal or manifest, and we should manifest our love to the children through simple sharing and togetherness. I think this is a very important part of this webinar. If there's one thing we have to learn, it is not only the medical part that we should conquer. It is also this part. This is more. It will give us a stronger impact on the development of the child. Okay, so they have an acronym which is PETAL, means play. A child playing, that's part of his growing up. It builds up resilience and stamina. Educate and prepare the children. So huwag natin bobolahin. Ituro natin kung ano talaga yung tama. Okay? And we should tend to their emotional needs, the needs of the child and the family. We should assist during medical procedures. We should lend financial and medical assistance, and we should support parental involvement. The parent has a very, very important role in this one, because every child has the right to learn, to play, and to grow, even when confined in the hospital. And I might add, even if she or he has cancer. Thank you very much for listening.
Okay, another excellent summary from Stella. I don't know how she and Menchit do this, but they really are able to capture the highlights of the presentation. So thank you so much. That's Dr. Stella Marie Legaspi, who's the Deputy Director of the Philippine General Hospital. Okay, next week. We're going to tackle liver disease, in particular, fatty liver. And I know this affects a lot of people. So join us. We're going to talk about fatty liver disease. I don't know if we're going to, Raymond, are we linking it to COVID? Not sure. But we will talk about fatty liver. And yeah, we have a hepatologist, gastroenterologist, Dr. Janice Ong, and we'll have a reactor also from the Philippine General Hospital. So join us. Very, very important discussion, and we hope that these updates really help you in all of the work that you're doing. Okay, over to you, Raymond.
Thank you, Dr. Susie, and thank you to Deputy Director Stella Jose for her synthesis and closing remarks. What you are seeing on the screen are the inputs from 77% of our survey respondents po, no, at the very least. So based on the responses, at least 94% of our respondents strongly agree with all of the statements, which is reflective of the high reception, being well received po ang ating webinar and webinar topic and our speakers that matter for today. Maraming salamat po at sana po to Dr. May and to Xiao, at sana po ay marami po kayong natutunan with regards to really helping out children with cancer. Tandaan nyo po, today is the last day of the International Childhood Cancer Month. Okay, before we conclude our program, we'd like to thank the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we won't be able to churn out quality content each and every week. And finally, all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel for your convenience. You just go to youtube.com/TVUPPH for you to be able to see all 118 webinars. And then thereafter today, magiging 119th na po siya. This formally closes our webinar for this week. Makita-kita po tayo again next week, next Friday from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy. See you online.